Is mesh bad? So mesh is in the news a lot these days, and there are a lot of class action lawsuits against mesh. It is important to remember that mesh is not necessarily bad. In the right patient, in the right situation, it may be the right surgery. There are complications associated with mesh, and I like to use the analogy of mesh as sort of like a knee replacement. When you go to see your orthopedic surgeon, because your knee hurts when you walk, you expect to be told, have you tried physical therapy? Have you tried a knee brace? And if those have already been accomplished, we next move on to scoping your knee, repairing your knee with your own knee's parts. Mesh is a knee replacement. And we all know someone who loves their knee replacement, and we all also know somebody who's had complications. Because when we put a foreign body in your body, there's risk of infection, of it not being taken well. And in the vagina, those risks predominantly expressed as vaginal erosions, or erosions into other organs, or pain with intercourse. And the tricky thing with mesh, if you have someone who's not experienced using it, is if you put it in too tight, like a hammock that's too tight, it's not comfortable. If you put it in too loose, like a hammock that's too loose, it is not comfortable. And so it has to be placed just right. Why are there lawsuits? The lawsuits stem in part from the fact that for a while, surgeons thought that the surgery looked better to us, it was easier to do, and truth be told, it paid a little more. And so some surgeons started putting it into everybody they saw. And the problem with that is that if all you have is a hammer, suddenly every nut and bolt starts looking like a nail. And it wasn't the right surgery. So while it may have been the right surgery for someone who had already had prolapse that had come back, who was not sexually active anymore for whatever reason and didn't plan to be, it was not a great surgery for a 30-year-old who was having a mild prolapse being corrected for the first time and was still sexually active. Lawsuits because patients were not always counseled appropriately before these surgeries.